Hey folks, Doc here, your favorite retired Army medic and bushcraft buddy. Today we're diving into something that every single person should know. Not just wilderness fanatics, but parents, hikers, campers, weekend warriors, heck, even your grandma. These are the top 5 life-saving first aid skills everyone should know, plus 3 bonus tricks from my own field days that you probably haven't heard before. Let's jump in, because the most powerful survival tool isn't your knife. It's what you know. 1. CPR, cardiopulmonary resuscitation. Why it matters. When a heart stops, seconds count. CPR keeps blood flowing to the brain until help arrives. How to do it. Step 1. Call 911 if you're able, or have someone else call while you're starting CPR. Step 2. Make sure they are laying flat on their back. Step 3. Check the mouth for obstructions, check for a pulse and to see if they are breathing. Turn your face towards their chest. This not only lets you feel the breath on your face, but allows you to look and see if their chest is rising and falling. If no breath or pulse is present, it's time to start CPR. Step 4. Tilt the head back to open the airway. If the airway isn't open, your breaths will not be as effective. Step 5. Give 2 rescue breaths. Pinch the nose closed and breathe into the mouth. Tip. If you do not want direct contact, use your other hand as a barrier between you and them. Just make sure you have a good seal, so air is not escaping before going into their lungs. Step 6. Begin chest compressions. Make sure to interlock your fingers and keep your arms straight, pushing directly down on the center of the chest. Push hard and fast in the center of the chest, about 2 inches deep. Try for 100 to 120 compressions per minute. Give 2 rescue breaths every 30 compressions. Watch out for this common mistake. Don't stop compressions for more than a few seconds. Most people pause too long between sets. Give 2 rescue breaths and go right back to doing compressions. And don't worry, ribs can break. That just means you're pushing hard enough. Step 7. Continue CPR until help arrives and takes over, or the person begins breathing on their own. 2. Choking rescue, Heimlich maneuver. Why it matters. A blocked airway means brain damage in minutes. How to do it. Step 1. Stand behind them, wrap arms around their waist. Step 2. Make a fist just above their belly button and wrap your other hand over it. Step 3. Thrust upward as you pull them into you, hard and fast, until the object comes out. Common mistake. Slapping them on the back while they're standing can push the object further down. Unless you want to make that grape a permanent resident, go for the abdominal thrusts. 3. Bleeding control, hemorrhage care. Why it matters? Uncontrolled bleeding can kill in minutes, even from a leg or arm wound. How to stop it? Apply direct pressure with cloth or gauze. Keep pressure applied, wrap and secure the wound with gauze, cloth, your t-shirt, or whatever else you have. Note, you can place your knee or elbow over arteries on the inside of the leg, just under the groin area, or on the inside of the arm, just under the armpit in the center of the inner arm, to help stop blood flow. Elevate the limb if safe, and keep reassessing to make sure the bleeding is controlled. If that fails, apply a tourniquet 2 inches above the wound and never place on a joint. Go above the joint if needed to ensure bleeding stops. Make sure you turn the windlass or improved windlass, the stick, tight enough to stop the bleeding. Do not worry about comfort. It's going to hurt, but it's also going to save a life. Please do not place a tourniquet on the neck. I know you're like, why did you just say that? Well, let's just say I feel better saying it even though it's obvious. If they have a neck wound, use direct pressure to control the bleeding the best you can in that area until help arrives. Biggest mistake, loosening a tourniquet. Never do this unless you're trained and in a hospital. Think of it like a bouncer at a nightclub. Once that tourniquet's on, no more guests allowed. I have included a couple video links for more thorough bleeding control method videos and tourniquet types, as well as applications in the description. The biggest thing you can do is remain calm and keep focused on controlling the bleeding. If you panic, they panic worse. 4. Splinting broken limbs. Why it matters. Improper movement can turn a break into permanent damage. How to do it. Step 1. Wrap or dress the wound. Never push a protruding bone back into the body. This is very important. Movies are movies for a reason, and this movie move could cause more damage or cut an artery, making a bad situation into a life-threatening one. Step 2. Immobilize the joint above and below the break. Use sticks, tent poles, or trekking poles with padding. Step 3. Wrap it snug, but not tight enough to cut circulation. Watch for swelling, numbness, or bluish skin below the injury. If so, loosen slightly. Duct tape and common sense go a long way. Just don't tape your buddy to a tree and call it good, even if it's the one who ate your last granola bar. 5. Treating shock. Why it matters. After an injury, the body can go into shock, shutting down blood flow to vital organs. How to handle it. Step 1. Lay them down and elevate their legs. This helps with blood flow to organs and keeps blood in the core areas of the body. Step 2. Keep them warm and calm. Use what you got to keep them warm, even if that means using leaves as an insulator. Remain calm and talk to them as shock takes hold. Altered mental status get worse, so do your best to keep them calm and awake. Step 3. Loosen tight clothes if they are causing restriction. Only loosen what you need to. A limb does not take priority over the core of the body, and never loosen a tourniquet if you have applied one. Step 4. Give small sips of water only if they're awake and not vomiting. If they begin vomiting, roll them to their side to prevent choking hazards. Common mistake: ignoring subtle signs. Confusion, pale skin, or fast breathing equals early shock. If they're shivering and mumbling like they just saw Bigfoot, treat for shock. Bonus skills. 3 out-of-the-box survival medic. Tricks for you to keep in your back pocket. 6. Duct tape, butterfly stitches. Gash too wide for a bandage? Cut thin strips of duct tape into butterfly shapes and pull the wound edges together. It's not pretty, but it works until you get help. 7. Sanitary pad field dressing. Don't laugh. Sanitary pads are sterile, super absorbent, and stick well to skin. If you've got a bad wound and no gauze, pad up and patch it. Tampons work great for plugging up holes as well. Not only do they expand, they are sterile and work great if you don't have gauze to pack a wound. Note: if your brain went there, that's on you. I can only edit a line so many times trying to keep this educational here, folks. 8. Use crushed plantain leaves for insect bites and stings. Crushed plantain leaves, not the banana kind, can pull venom and reduce swelling from bug bites and bee stings. Just chew it up a bit, or mash with water, slap it on, and hold it in place with a bandana or tape. This trick's been used since ancient times, and yes, it actually works. Mother Nature's antihistamine, right at your feet. Knowing how to use gear is great, but knowing how to save a life? That's next level. Master these 5 essential first aid skills, and you won't just be a better hiker, camper, or adventurer. You'll be someone people can count on when things go sideways. And hey, stick around. This channel's got you covered with survival tips, bushcraft tricks, and life-saving info every week. So hit that like button, leave a comment, and make sure to subscribe and share. It really helps this channel grow and reach more people. Because the more we all know, the better. Stay sharp, stay safe, and I'll see you in the next one. Doc out.